Welcome and bienvenue to the AGE-WELL EPIC Conference 2024. It's a privilege to be here with such a distinguished community of innovators, researchers, professionals, and stakeholders dedicated to advancing the age tech sector in Canada, and more importantly, to improving the lives of older adults and caregivers through technology and technology-related solutions. I'm Samantha Sandassie, AGE-WELL's Director of Education and manager of our spin-off training platform, EPIC-AT. It's my honor to kick off this exciting event this year. Over the next 2 weeks, we will explore cutting-edge research, innovative solutions, and the incredible potential of technology to transform aging. Now, although we're meeting virtually today, I would like to begin by acknowledging the Indigenous peoples of all the lands we are on today. This acknowledgement reaffirms our commitment to improving relationships between nations and deepening our understanding of local Indigenous peoples and cultures. I encourage you to reflect on the land where you are situated and your relationship to it and its traditional keepers. The AGE-WELL Network Office operates on the traditional territories of many Indigenous nations, including the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We also recognize the current treaty holders, the Mississaugas of the Credit First Nation. This land remains home to many diverse nations, First Nations, Inuit, and Métis peoples, and is subject to the Dish with One Spoon Wampum Agreement, which promotes peace and cooperation among peoples sharing the Great Lake region. I am grateful to have the opportunity to work on this land today and acknowledge our accountability and responsibility to further the reconciliation process. AGE-WELL is committed to fostering equitable and inclusive practices across all of its programs, and we explicitly welcome and strive to incorporate Indigenous ways of knowing and being throughout our research, education, and implementation programs. AGE-WELL, Canada's Technology and Aging Network, was launched in 2015 to address a real need, a very real need, the need for better solutions to address the challenges of aging well in Canada. Our mission is to help older Canadians maintain their independence, health, and quality of life through innovative technologies and services. Older adults are a rapidly growing segment of the Canadian population. In fact, there are more people over the age of 65 than children under 15. And population estimates indicate that 1 out of every 4 individuals will be 65 or older by 2030. This is a massive demographic shift, and our health and social services, our businesses, and our products must change to accommodate both the existing and emerging needs of an older population and those that care for them. As a network, AGE-WELL brings together researchers, students, government, industry, community partners, and more importantly, older adults and caregivers. Together, we create and implement technologies and policies to enhance well-being and quality of life. Since AGE-WELL's inception, we have supported over 350 researchers, trained more than 1,500 trainees and research staff, and engaged over 5,000 older adults and caregivers. Our collaborative efforts have led to the creation of over 170 solutions, including technologies, services, and policies, and we support over 70 startups, many of which were founded by our trainees. The EPIC Conference, now in its 5th year, was born out of the need to create a virtual and accessible space for our community to share their stories, learn about innovative work, and network globally. Last year, we were proud to host over 1,000 delegates from over 21 countries across 6 continents, making the EPIC Conference the largest virtual conference in the age tech space. This year's EPIC Conference, running from May 21st to May 30th, offers a unique platform for our community. We're gathered here virtually to share our findings, our latest findings, to discuss impactful projects, and connect with colleagues from around the world. Our program remains rich and diverse. We will have 8 panel presentations organized around the 8 challenge areas. If you're not familiar with our challenge areas, these are 8 complex problem areas that we've identified as spaces that demand age tech innovation and the deployment of real-world solutions now. Each panel will open with a short presentation by the session chair that provides an overview of the research and innovation in the challenge area. This will be followed by 2 research presentations co-presented by stakeholders and trainees. And then last, we are especially delighted to close each panel with a new segment called Moving the Dial. These presentations will highlight how AGE-WELL partners and supported startups are improving quality of life for Canada's older adults and caregivers. I encourage you to explore the EPIC conference webpage for the full program and to register for all sessions of interest. All conference sessions are free of charge, and we welcome everyone to join the conversation, to ask questions and learn about innovations that could impact your life or the life of someone dear to you. For those using social media, you're welcome to tag the conference using the hashtag AGE-WELL-HQP2024. As we come together to collaborate, to connect, and foster an inclusive community, we recognize our shared responsibility to create a welcoming environment for all. We value the participation of each community member and strive to deliver an enjoyable and fulfilling experience. All participants are expected to conduct themselves with integrity, courtesy, and respect, observing our code of conduct, which is available for your reference on the conference website. I would now like to extend my heartfelt thanks to the organizers, particularly Alison Schneider, AGE-WELL's Education Manager, without whom the EPIC conference would not exist. I'd also like to thank our AGE-WELL partners, and especially to the stakeholders, the students, postdoctoral fellows, research staff, and early career researchers who will be sharing their work with us this week and next. Your contributions are vital to the success and the future of AGE-Tech in Canada. And the future of AGE-Tech has never been brighter. Thank you, and let's have a fantastic conference.
Thanks very much, Sam. My name is Andrew Costa, and I'm going to be carrying the session today. And so good morning, good afternoon, wherever you're coming from, and welcome back from hopefully what was a very good long weekend of good weather across the board. For today, we are kicking off with the first session of the conference, which is supportive houses, homes, and communities. And in addition to a short introduction that I'll provide to the challenge area, we're excited to have two EPIC presentations, one by Sara, Hanafy, and Farhad Keramati, and another by Laura Ault and Nadine, Carroll, and followed by a Moving the Dial presentation by Claire Andrews of Best Buy Health Canada. So before we begin, I will launch some visuals. There we go. Before we begin, I'd like to note that, as you see today, we are gathering for our first session. The EPIC conference sessions take place here on Zoom from 12 noon to 1 p.m. Eastern, Tuesdays to Fridays this week, and Monday to Thursday next week. And so, as Sam mentioned, we encourage you to attend all the sessions, check out the AGE-WELL EPIC conference webpage, download the conference program, which includes all the details for all the sessions that are coming up and all of the challenge areas themselves. And so for today, we have two research presentations followed by a 5-minute Q&A for each of them. And then, as I said, a Moving the Dial presentation followed by a general Q&A. We really hope, and we've got a big group here, that you as attendees contribute to the discussion of the session. And so we really invite you to put questions in the Q&A, please, and about thoughts you have that you want response to, potential research and real-world impact around the discussion that we're going to have today. And leave a comment or a question. You can upvote questions that have been submitted. I will address those in order of your priority for some of those questions. And again, put that in the Q&A box, please. Where you have sort of like general thoughts that you don't want to be addressed or responses to the presentations, you can put that in the comment box. That will just help keep me a little bit on track, if you don't mind. The sessions are recorded and they'll be available for playback, and links to the playback will be posted on the EPIC conference webpage. And you'll also see that on the AGE-WELL YouTube channel. And so we'll get started. So again, my name is Andrew Costa. I'm a professor at McMaster University. I'm also the research director for the St. Joseph's Health System Center for Integrated Care. That is in Hamilton, Ontario, Canada. I have a Canada Research Chair in Integrated Care for seniors. Supportive homes and communities is near and dear to my heart, to the panelists' heart, to all of yours, and is a fantastic challenge area of AGE-WELL, a very busy challenge area where there's a number of projects and startups that are hosted here. And so to start us off in the challenge area, I'd like to talk about some trends and some bets. Excuse me as I jog along here and move something out of the way. Great. And so as the theme suggests, aging in place is about being able to live independently in one's own home and community. And home and community is a particular sort of, should be maybe underlined here, with appropriate supports and services. And we are all engaged in this work in terms of smart homes, sensors, safe navigation, online portals, as well as sort of social engagement programs and that were used to utilize technology. And to start us off, I have no disclosures. I thought I would just maybe provide a little bit of context near and dear to my heart around opportunities and challenges for supportive homes and communities in Canada. And so I'll discuss some big trends that I know that we're all aware of and responding to, and give some thoughts on where I think the safe bets are in the future. And maybe you'll have different thoughts on those. And that, together with the presentations, hopefully will lead us towards a fantastic discussion. And so the trends I'd like to chat about, no surprise, demographic and human resource shift being pretty important. I think how they come together is really going to be really instructive in terms of what technologies are taken up where and in what time frame. And then immigration patterns and changing preferences for aging that we are seeing. And it is to some extent a little bit of anyone's guess in terms of how that influences the markets for aging products, et cetera. Perhaps you've seen this. If you've taken an interest in gerontology, this is like the first thing you see. And personally, it's what inspired me to do the work that I do. You'll note from 1984, any year in a median growth scenario, all the way up to today in the middle and into the future, jogging forward about a decade or so, we see a substantial shift in our population. And it's because people are living longer. That's definitely the case, but it has a lot to do with birth rates. And birth rates as being extremely, extremely important. This picture defines a lot in our society, where investments occur, at what time there are investments for new technology, when the demand hits, at what time, for what sorts of traditional resources. These trends dictate the broad view for a lot of that, I would suggest. Take, for example, just one example, long-term care beds. These are so-called nursing homes. This is an Ontario picture. On the left, you'll see a diagram there that describes essentially a pattern of the population over the age of 65 growing and the number of beds growing as well in response to new investments. On the right-hand side, you see actually the real picture, which is adjusted for the population over the age of 65. In Ontario, in any case, we're seeing basically just, if we're lucky, a stabilizing of access to nursing homes at a rate that is far less access compared to a decade or more ago. Why is that the case? And we're seeing, in fact, actually a lot of homes closing, whether you think that's good or bad. And they're closing partially because the individuals that run a lot of this infrastructure are also retiring at the same time. And so the dual picture of workforce changes and aging changes is influencing where our population is likely to age. This is some views around our human resource crunch. Interesting trends overall. Where I would focus your attention is that particularly around the more personal care-oriented professions, particularly in nursing and residential care environments, home care, retirement homes, assisted living, nursing homes, that's where we see the biggest crunch in terms of health human resources. That is also instructive for technologies, particularly because technologies that are influencing aging typically do not deal with direct care needs, bathing, changes, transferring. They support that, but it's very much a human resource. And so we're seeing our technologies co-occurring with human resources and personal care that is extremely human-based. What defines transitions into aging environments where individuals need support or in families need support to support their family members is typically around changes in cognitive impairment, which is coupled with changes in function. And we've seen, thankfully, changes in risk factors that is decreasing the incidence of dementia. But given the changing in our population getting much older, we're still seeing and expect to see, obviously, a lot of demand. So where does this demand spill over? It's spilling over away from publicly directed nursing homes into private areas like retirement homes, where we're seeing threefold increases in across operations, and in naturally occurring retirement communities. And even though individuals want to age in their home, and certainly we can understand that, everybody can, individuals, because of the lack of human resources, go towards congregate areas where they can actually get access to human resources in a more efficient way. And we are seeing this now. We are likely to see this accelerate, particularly in the next decade, in an extreme way. Immigration is a phenomenon to our country that has been the case since the beginning. And immigration patterns are increasing and changing in terms of the regions of the world in which new Canadians come from. What's interesting to note is that those regions have specific risk factors around dementia. And so although we're seeing changes in incidence in some populations in Canada and in North America, we're not sure that's necessarily going to be the case for our newcomers, which might change the culturally specific demand for aging products and access to care. We see that, for example, taking the example of nursing homes again, where the highest demand for aging environments, as far as we can tell, in areas where we have higher immigration, is for those culturally appropriate spaces. And so finally, just concluding with some bets, very safe bet that congregate living of all types and all varieties are going to expand the next 10 years. And as preferences for aging at home collide with realities of affording care and affording and accessing human resources that is shrinking. And human-intensive personal care is less likely to be modified for technology. And so the work in combination, but how that combination will occur is, I think, very much in the air, I think, for folks here to consider and to build technologies around. And I think these technologies, for all of us, need to consider both the problem and the place together, in addition to preferences, because the ability for technologies to be adopted, just the plant operations, access to internet and so forth, changes depending on the environments that we plan to build for. And of course, we should be building for problems and for environments. And environments and problems coexist as people find environments that serve their needs, and then technologies come along with it. Ethnocultural care is real, in case folks weren't aware, and culturally relevant care is not nice to have. It is absolutely critical to all of our future, I think, and to the well-being of Canadians that are aging. And so some big trends, and thanks very much for that. Now I'd like to shift. And so very excited to introduce our first presentation by Sara Hanafy and Farhad Keramati. Dr. Sara Hanafy has recently completed her doctoral degree at the University of Toronto at the Rehabilitation Science Institute in the area of traumatic brain injury within clinical and non-clinical outcomes and associated comorbidities. She received her Master's of Science degree in biomedical sciences at Queen's University. Dr. Hanafy currently works as a postdoctoral fellow within the BEST lab at KITE, Toronto Rehab, and UHN, examining perspectives of older adults and stakeholders on remote monitoring technology to maintain independent living. Farhad Keramati earned his master's degree in computer engineering from the University of Toronto. He's been involved in various projects centering around the design and the development of smart home technologies, the Internet of Things, and their applications to healthcare. His master's project was focused on the use of edge processing technology for the aggregation and analysis of large-scale Internet of Things data collected from associated devices using various communication protocols such as Zigbee, Z-Wave, and cellular networks. In 2019, he joined the SmartONE Solutions, not the SmartONE Solutions, as the Chief Technology Officer, which is leveraging his education experience to lead the development of technologies for building and managing smart communities. So very relevant. Welcome to you both. Over to you.
Thank you very much. Just before beginning, are you able to see my screen clearly?
You bet.
Okay, great. Good afternoon, everyone. Thank you very much, Dr. Costa, for the warm welcome and introduction, and to AGE-WELL for the opportunity to present today. Today, Farhad and I will be speaking on the program to accelerate technologies for home care, also known as PATH, led by Dr. KITE-UHN. So Dr. Costa did cover this a little bit, but just to have a quick look at aging within Canada. So from 2016 to 2021, we've observed that the number of persons aged 65 and older rose to approximately 18.3%, about 7 million, accounting for 1 in 5 Canadians, or 19% of the total population. This is expected to grow further, in which by 2030, we are expected to see a proportion of the total population of those aged 65 and older to approximately 23%. This is a significant demographic shift. With the growing elderly population, there is a greater demand for services that cater to their well-being, as well as to really preserve their independence with aging in place and living independently within their homes. This includes preventing accidents and illnesses, but as well as managing their already existing comorbidities or chronic health conditions effectively. And this can potentially really reduce hospitalizations as well as emergency room visits too. At the same time, with having this approach, we can hope to reduce the burden on their family members or their friends, any informal caregivers who have taken on the responsibility for caring for older adults. And so this is really the ultimate goal as well as objective for PATH. So what exactly is PATH? PATH provides a hub with a unifying technology that combines multiple communication protocols to connect really different types of sensors, actuators, and devices through a single interface to a cloud-based AI engine. PATH receives input from 3 sources, really, including home health devices, as well as SmartONE APIs, in which Farhad can speak a little bit more on that, for the provision of data storage, AI, as well as analytics. Its unique feature really is quite versatile. It includes the power of connectivity, so really bringing the ease of use of plug-and-play platform, data extraction, so the integration and making sense of what the data is from different sensors and devices, affordable open access infrastructure for researchers and developers across Canada, even internationally, commercialization, so bridging that gap between invention and commercialization with efficient testing in large samples. And really a great strength also includes the potential for partnerships and growth. For instance, in addition to the work that we do at the KITE Toronto Rehab Institute, University Health Network, we have national collaborators across Canada, including the Pearly and Rideau Veterans Health Centers in Ottawa, the Schlegel UW Research Institute for Aging in Waterloo, and the Glenrose Rehab Hospital in Edmonton. We have partnered with SmartONE Solutions, Inc., and currently have an interface system installed in KITE at the Toronto Rehab Home Lab, as well as within the simulated home laboratories within the institutions that I've just mentioned. So this system ultimately connects the simulated homes to the outside world via the fiber optics. This was the layer 1 of PATH, and now we are beginning to transition to layer 2 of PATH. And what this entails is the successful technologies from layer 1 will transition to real-world settings with the aim of 350 homes participating at no charge for the first year.
So in SmartONE, what we do is we build smart communities, as Andrew mentioned. But before talking about the connection between smart communities and PATH project, I explain a little bit about what smart community actually is. So smart communities are very similar to smart homes, if you're familiar with that. But we take that concept and we move it to building level or even multiple buildings. So if within your smart home, you have smart devices and connectivity to your lighting system and blind and sensors within your smart home, in smart community, you have the connectivity across building with the building security system, building access system, and everything pretty much that somehow relates to your experience of living in a community. Now, in order to be able to create that level of connectivity inside the suite and in the building, there are a lot of technical challenges. So that's why in the past 5-6 years, we have spent a lot of time going through different protocols, different ways of connecting to different systems in the suite and in the building. And we have done all that work to be able to create a platform that gives easy access for connecting to all these systems. And that's really where our collaboration with PATH gets to. So what we provide is a platform so we can easily gather data, we can easily connect to new devices without having to go to and do all the hard work that needs to be done to be able to work with the protocol and do the translations. We integrate with a lot of third-party systems, both inside the suite and in the building. So you can, for example, you can connect to your energy monitoring system that tracks your energy consumption. You can connect to your access, the building level access. So now we can kind of monitor who has access to the community, and also we can give access to the people that should have access. So when you think about it, we're not only talking about connecting devices, we're actually talking about the whole experience of living in a community. That's where really SmartONE comes into play. Next. So smart communities can be looked at in different settings. You can think of it in a setting of a regular residential community. And you can also think of it in terms of senior care and senior living. Something about our solution is that it can be really customized for what kind of community it is being built for. And things get really interesting when we talk about senior care and buildings with more of a senior demographics. And what that means is now we can use our connections and we can use our network to connect to a lot of health monitoring devices within the suite. And also we can allow connectivity to family members of those who are living in that community, healthcare providers, and people in the building between themselves. Because one big part of senior living and senior care is not just about monitoring and tracking the health, it's also about the experience we're giving to people who are living in that community. That's a very big part of it, and we cannot really overlook that. So what we're trying to do is that we're trying to create a solution for the experience as well as the health monitoring and making sure everyone's fine. Next. So these are some examples of devices that we're trying within, let's say, the suite. Because we have the connectivity and we talk a lot of different protocols, it allows us to use, let's say, fall detection sensors, or use a lot of devices that can track your nutrition and drinking intake. And we can try these pretty fast. We are already in thousands of suites, which kind of makes it very easy for us to introduce a new technology and do a quick feedback and iteration on it to see how it worked and make it better. Because being able to deploy these solutions quickly and get feedback is the only way to progress really fast and building the technology. Next. So that pretty much sums up the collaboration of SmartONE and within the PATH projects. And you can go to www.pathplatform.ca for more information about PATH project.
Thank you, everyone.
Thank you, Sara and Farhad. That was really neat. Extremely valuable. I've got a question for you, and others are going to populate the Q&A. The first is, what's the most popular technologies? And you listed sort of some examples in the smart homes and communities that you're working with by far. Like what are the most popular ones now, and what are the characteristics that seem to dictate which ones are popular versus not?
That's a very good question. I wish somebody could answer that question for me, because right now, when it gets to smart home technologies, there's a lot of competition trying to find the best technology. I'm assuming by technology, you mean the protocol that is used to connect devices. Is that correct? There's a lot of competition right now between different protocols. Nobody really has the final answer. There is a big effort in order to kind of converge to one protocol that allows everybody to just connect the easiest way possible, and all the different companies to be able to work within that protocol. Definitely Matter seems to be the one that is, Matter protocol seems to be the one that is, that has a lot of promise. It has a lot of challenges, but I don't think those challenges are specific to Matter. It's just challenges of making a full industry agree on one protocol. But if you ask me, I would say right now, Thread and Wi-Fi, which is going to be the base for the Matter later on as well, are the really main protocols with a lot of promise.
Because someone asked, maybe just clarify, how is what you've presented different from the Matter standard?
So Matter is a protocol, and we use Matter too. Like, we're developing and working with Matter protocol. So what we build in a lot of cases is not build the underlying protocol ourselves, is use those protocols to create a platform that everybody can join and benefit. So we use Zigbee, we use Matter, we use Thread, we use Bluetooth. We use all these protocols to create that platform for other people to be able to connect to.
That's great. We'll leave it there, but I'm sure we're gonna get more questions as we proceed, and we'll have a chance at the end to ask our questions as well. I want to turn it over now to our second presentation with Laura Ault and Nadine Carroll. And Laura has been working as a research coordinator for the Bruyère Research Institute in Ottawa for just over 6 years. With her background in biomedical engineering, her projects typically involve sensing technology to support aging adults and allowing them to continue living in their own homes. When she's not at her desk, you can find her taking her dog for a walk, especially now the weather is cooperating, and it really is where we are now, which is great. She wants to thank Bruyère, AGE-WELL, Esprit AI, and the team members at the Greystone Village for their support of the project. Nadine Carroll is a registered nurse with over 9 years of experience working in different clinical areas like critical care, community care, and now continuing care. Nadine now works as the clinical educator at the Greystone's Transition Care Unit in Ottawa. And she loves working with the geriatric population and has specialization working with people who have dementia. That's critical. And Nadine is also a certified GPA coach and loves teaching. And before coming in RN, she was a registered kinesiologist. Also loves getting outside and being active with her family and 2 large dogs, which I'm sure was the weekend or something. So thanks to you both, and over to you.
Wonderful. I will start sharing my screen. All right, can everybody see that? If someone can just sort of
That's
nod.
perfect.
Wonderful. Thank you so much, Dr. Costa, for the introduction. Our project presentation's title today is Customizing Supportive Smart Technology on the Dementia Care Unit. It'll be presented by myself, Laura, and Nadine. Quick other intro, just aside from the one that we were just given. So as Dr. Costa mentioned, I'm a research coordinator. I have been in the research space now for about 6 years, with all of my projects being very much centered around sensors to support aging in place, or as it was mentioned in the comments, living well longer in place. I have a biomedical engineering degree and then a master's degree in engineering management. And I'll let Nadine give a little quick intro for herself before we jump on.
Hi, everybody. Thanks for having us. Yeah, not too much to add. It's been a pleasure working with Laura and her team. This was the first time that Greystone was able to have a research program starting at our facility. So it was really, really interesting to go through the process and learn a bunch from them as well.
Wonderful. So this is sort of just our agenda for today for our presentation. I won't dive too much because I'm assuming that everybody can see this. And if you can't, don't worry, you're not going to miss too much. Before I do jump in, I do want to just give a little bit of a shout out to all of the supportive hands on this project. None of this could happen without the support of AGE-WELL, Bruyère, of course, Greystone Village, and the staff at Bayshore Healthcare, Taffeta, Carleton University, and all of our technology was supplied by Esprit.AI. They are a local startup here in Ottawa. And just a special thank you to Dr. Frank Canilfel, the PI on this project, for his support. A huge thank you to not just Nadine, but all of the staff at Greystone for their continued efforts and communications within the project. And then Patrick at Esprit.AI for the sensors and the expertise that come along with smart technology, because it's not easy to do. So let's jump in. I'll pass the mic to Nadine to explain what a transitional care unit is.
So exactly, what is a TCU? It is where I work. Greystone Transitional Care Unit is one of the transitional care units that is operational through Bayshore, which is the division of that I work for. And it's a hub. It's a spot in between. Our patients that come to us are not considered medically acute anymore. They're medically stable. So where do they come from? Majority of our patients will come from an acute care hospital setting. They're usually deemed within the hospital setting as an alternate level of care, or ALC. They can't go back home. It's not safe for them. They don't have the supports. They don't have the supplies. It's not feasible for them to go back home. So usually the projection is for them to go to a long-term care facility, and there's a wait list. So before they can get to that long-term care, we are able to get them out of the hospital setting and optimize them with rehab, with integrated types of cares, all kinds of different interprofessional disciplines work within the TCU, registered dietitian, social work, OT, PT, rec, rehab assistants, you name it, we have it. And they stay with us. On average, they stay with us for about 3 months. I think 76 days is the average length of time. Some leave our facilities a bit sooner. They likely go to geriatric rehabilitation if they meet that criteria, but the ones that stay a little bit longer are slated to go to long-term care. So that's really the kind of the main population that we have. It's primarily geriatric, and usually that trajectory piece is going to long-term care.
Thank you, Nadine. I will bounce us over. So our research project had sort of 3 pillars. We have our participants, we have our technology supplied by Esprit.AI, and then a huge component to the project's success was the staff communication. So recruitment and participants were identified by the staff at Greystone with Nadine and her other staff members, pointing out people, patients on their unit who were maybe falls risks or had frequent bed exits that maybe they wanted to monitor or stop before things got before they stayed up too late in the night. And our study ran for about 26 months. No participant was in the study for the full 26 months. This was also over COVID, but we had, I know as Nadine said, sort of people coming and going in and out of our study, and we were able to get 8 people in over that 26-month period. Our technology, Esprit AI, we in each room, so for every participant, we had a motion sensor, a bed occupancy sensor, and a system hub. And the system hub is what allows myself as well as the Esprit AI team to see the sensors remotely and provide sensor rules and behaviors to provide alerts to the staff members, which were sent to a cell phone that they carried at night. So all of these alerts were strictly for nighttime because it's a little bit harder to sense things during the day. And then on the staff communication side, you know, we had regular meetings with our staff members, with staff members at Greystone to discuss, you know, changes that needed to be made in the system, just to make sure that, you know, we weren't providing more work, but also wanted to make sure that our system was actually supporting their work and the patients on the unit. So I'm going to show you guys a quick little decision tree. And this is kind of how we sort of start the system behaviors. This is sort of the, you know, the first pancake, if you will, of how each system is set up. So is the patient a high falls risk? If so, they probably want alerts to be sent to staff members as soon as that person's bed occupancy sensor says out of bed to prevent a fall, or, you know, assuming that, you know, maybe the fall happened as soon as they get out of bed, staff members can go and provide assistance right away. If not, are they a wanderer? And if so, do they need a time delay for when they get out of bed? Are they okay to get out of bed, go to the bathroom, and then return back to bed? And if so, what's that time delay? And this is something that we would revisit continuously during the project. So myself and Nadine met every single Monday for almost 2 years straight to discuss how the week went previously, to ensure the staff members got, you know, the alerts that they were supposed to, or didn't get, if they missed alerts. We wanted to make sure that we addressed things because certain sensors would get taken off walls and put in drawers. So from a back end perspective, it looks like to me, everything's online and everything's great, but a motion sensor can't detect motion if it's sitting in someone's garbage. And that is a real true life story. And so a little bit other part of our project was the layout of the unit. The unit floor was kind of shaped like a T. And so, you know, what we had to do is make sure that, you know, the nursing station, which is marked by the star, was getting appropriate messages so that they're not running around looking for patients who are actually still in bed, even though the sensor has said that they were out of bed. And that's where this kind of constant communication comes in with the staff members, you know, checking in. Are they getting the right alerts? Are they getting too many at night? Are they getting so many that they want to put the phone away and then our research isn't actually supporting them? And so for an example, our very first participant was very active in the nighttime and they got out a lot at night. So for the first little bit, they were sending 20+ alerts to the nurse's phone, which is just far too much. And we were able to bring that down sort of to 5 to 10 after the first iteration, and that's with that little time delay, and then even bring it down to sort of around 3, where the staff could say, okay, now I need to go and support this resident. So that was really a big factor in the success of the project, was this constant communication between myself and Nadine. So I'll pass the mic over to Nadine if there's anything left to mention on that side, because I have taken a lot.
Definitely. We were within the site at Greystone, we were checking in with all of our staff as well, because our staff rotates through. So some of them are patients, or sorry, some of our staff will do mainly night shifts, some will do day shifts. The ones who are working nights are the ones who are coming into the system more readily, but making sure that the staff were doing okay. There had to be that buy-in for them to really be on board with it. And so we were just checking in on a weekly basis as well with the staff to make sure that they weren't receiving too many alerts that weren't able to help with their workload on a regular basis.
And something that I want to, make sure we end off to is also that we noticed that the the big staff acceptance and empowerment feeling as we communicated with them on the research side. So a lot of research studies with technology, it's very hard to bring in a new piece of technology, just put it in and leave it and walk away. And then, we collect data, but having that constant communication, I know the staff felt a little bit empowered, like they were part of their patients' care. And I think they felt really good about that. So it overall worked really well. But the reason that this study worked really well is because we had that constant communication, between myself, the staff, and as also our Esprit AI tech gurus. So that's, I believe, our 10 minutes there. So I will cut it off there. If there's any questions, I'm here for them.
Thanks, Laura. Thanks, Nadine. That was excellent. We are seeing questions trickle a little bit after presentations, which is fine. It'll give us plenty to talk about in the end, as folks sort of consider what you've said. I have one, which is where you're thinking of staff needs and changes and so forth in the space. Is there any kind of, have you noted sort of a conflict between the desires of families and caregivers and the residents themselves and staff, and how does that influence technology adoption? Curious.
That's so not just with this study, but with a lot of other research projects that I've been on. That's a huge hurdle to navigate, a very large challenge. With this project specifically, the staff at Greystone would identify a participant and approach their care partner or their POA, power of attorney. I would call them and say, are you okay if I put sensors in your loved one's room for these reasons? And that typically they were okay with it. On the staff side, in other institutes, not Greystone, we had lovely staff at Greystone, but in other institutes, it's hard to bring technology that requires more work on their already very busy schedules. They're already pretty tapped out, especially in the night shift. And then I come in and say, hey, on top of everything you're doing, can you also check on this phone and tell me if it's not working, or if it is working, or if it's working too well, that kind of thing. So having them involved with the weekly check-ins, and, me saying, if something doesn't work, talk to Nadine. She'll talk to me and I'll fix it like immediately. I think brought them a little bit more on board, even though I was asking them to do more. It made them feel a little bit like they were part of the research study rather than just passively participating. So I think that was a really big key in our success.
Yeah, thanks, Laura. Question is, any effectiveness results yet from the technology?
Nothing that I would say like could be clinically proven. We didn't have a chance to sort of say to the staff, stop your normal procedures and only rely on our technology, just because there's so many other regulations that would go with that. But what we did hear from our feedback with the staff, because we did do a post-study staff feedback questionnaire, is that a lot of them liked the idea of having the technology and having it customizable, patient to patient, but also as a patient maybe, progresses in their care, their rules and regulations with the technology can change. So if someone isn't falls risk, but then suddenly becomes a falls risk while they're in the TCU, we can change the system like that. And, the next night their staff will get alerts saying, patient XYZ is out of bed. So that seemed to be a very positive view of the staff. I don't know if Nadine has anything else she'd like to add on her end, because she was a little bit more staff focused.
I agree with Laura. The staff really did appreciate the fact that it wasn't extra work on their plate in terms of their workload through the night. But we were able to see some trends that didn't necessarily go along the same path as high falls risk. We were able to see before it was diagnosed, but we were able to see in one particular patient a progression with his disease process, and it was sending extra alerts. And so when we started to look into why those extra alerts were coming through, it wasn't because it was an increase of his fall risk. It was actually an increase or a progression of his disease process, getting up more through the night, monitoring pain, those types of things. And it correlated with the increases of the alerts, which was really, really interesting. And I think the staff really found that interesting as well.
That's great. Thanks, Nadine. You'll see wonderful questions that we won't have time to get to right now. So maybe you can answer some of those and type them in. We're seeing sort of probably ubiquitous questions mount around privacy and around insecurity, and also around quality of life as a consideration. So we'll leave those probably to the end. Those I think are becoming popular. Thanks again for that. We'll move on to you, Claire. And so for our move the dial presenter, Claire Andrews from Best Buy Health Canada is here with us. And so Best Buy Health Canada is driven by the belief that technology can make life better at any age for any need. Their goal is to empower older adults and caregivers alike, whether their focus is on aging in place or achieving independence and health goals, or finding new ways to connect others, all with the lens of quality of life. This is delivered through translating human needs into meaningful service offerings, such as curation, installation, and training of technology solutions at any place called home, designed to augment existing care models in Canada. Thanks, Claire. Over to you.
Thank you so much, Andrew, and thank you everyone for attending the presentation today. I'm thrilled to be here. I'm Claire Andrews. I'm the Experience and Research Lead with Best Buy Health Canada. I'm excited to talk about how we're doing some real world impact in the area of age tech, especially as it relates to supportive homes and communities. Before I jump in though, because this is a Moving the Dial presentation, I thought it'd be really good just to take a moment to reflect. So, you know, what comes to mind when you think of healthy aging? And what I ask of you is just to take a moment, either to write it down or pop it into the chat if you feel comfortable, but really thinking about how we currently, or your current perception of healthy aging. So just going to give you a moment here to, again, write it down or pop it into the chat. So I'm seeing a couple of things. Thank you for adding that in there. Choice. That's a huge part, absolutely. Preventative healthcare. Independence. Autonomy. Independent functionality. Healthy aging, dignity, independence. So we're seeing a lot of themes here, a lot of independence, autonomy. Choice was obviously another big one. Meaning and purpose. Quality of life, social inclusion, retaining functional capacity. So maybe just taking one more moment here just to add in anything else that anyone think comes to mind. Best health support. Well, thank you very much. And a part of what we do at Best Buy Health is always thinking about different ways and different elements that add to somebody's ability to age in a healthy way. And so with that in mind, we're constantly evolving what we think of when we think of healthy aging. And so what you see on the screen here is what we call sort of the healthy aging model, where we really see it happening in sort of 8 distinct areas. And before I go into them, I'm just going to tell you a bit about my background. So I come from healthcare. I'm a former occupational therapist, and I worked both in hospitals as well as in schools with students with disabilities. And a large part of the role of, or the way of thinking for occupational therapists is thinking in a holistic way about our patients, the people that we work with, when it comes to their health and their experiences. And so this same look, this same use of this holistic attitude when it comes to thinking about our individuals applies to what we do at Best Buy Health. And so on the screen here, we see sort of 8 different category areas that we think of when it comes to healthy aging. And this is something we're constantly evolving on as time goes on. I'm going to go through each of these in later slides, but I'll just introduce them to you now. So the first is observe and record health, connect to others, stay active, make your home setup work for you, add fun to the day, recover at home, increase mobility, and focus on mental health and well-being. This diagram, I think, is best described using a couple scenarios. So the first scenario is, imagine somebody who prioritizes, eating well, exercising regularly, potentially uses technology and has access to resources on learning how to use that technology. It could be for this particular individual with the combination of these healthy habits, including technology, that they're able to help prevent chronic conditions from happening in the first place. A second scenario could be somebody who, for instance, has diabetes and uses similar healthy habits to the ones I just mentioned, as well as technology to help them manage their condition. For this particular individual, again, it's the combination, amongst other things, of course, including these healthy habits like technology that help them to manage their condition throughout their lifespan. And so the purpose of this diagram is really to think about how we can help individuals develop healthy habits, of course, thinking about that with the realm of technology as well, to help either prevent or manage chronic conditions from happening in the first place. And that is very much speaks to what we do at Best Buy Health Canada, which is, again, those three main things. It's helping people prevent the conditions from happening in the first place, enabling them to stay well as manage conditions if they occur, because ultimately this does impact how and where somebody ages in place. So back to the model that I was referring to before. So I'll just walk through it here and provide a couple examples of what we think about when it comes to technology in those different categories. So the first being observe and record health. With this as a team, we're constantly thinking about what would help somebody track health measurements like, for instance, heart rate, blood pressure, blood oxygen saturation. So before I launch into some different ideas, I'll just get you again to think about different ideas that you have when it comes to this category. For us as a team, we think about examples such as smartwatches, for instance, pulse oximeters, blood pressure monitors are often different technologies we think of these areas. Connecting with others, because I know when, in the chat, especially too, we were hearing about social connection and feeling connected to our community. This one here is all about helping us stay connected to our family, our friends, our healthcare team. So what are some different solutions that come to mind? For us, it's things like smartphones, tablets, smart displays, as well as laptops. Staying active is a big one for us. It's supporting that active lifestyle, and we think about it both in the indoor and outdoor environment for individuals. Here we can think of things like weights, electric bikes, for instance, and hiking poles, enabling somebody to stay active throughout their lifespan. Make your home setup work for you is all about helping you set up the home in the way that you want it, helping you save energy and time and promoting safety. So for instance, a couple examples there would be things like automated lights and robot vacuums. Adding fun to the day always brings a big smile to my face because we know the benefits that fun has on our health and our well-being. And so we wanted to include this category because we know of its impact. For example, some of the solutions that come to mind for us as a team is kayaks, and yes, Best Buy does sell kayaks, speakers, as well as cameras. Recovering at home for us is helping individuals with rehabilitation after surgeries or injuries. And just to go through a couple examples here of what that might include, it could be bath benches, for instance, or grab bars. Increasing mobility, again, we're thinking about both the indoor and the outdoor environment. And so things like canes, walkers, and wheelchairs are different technologies that you can find in those categories for us as a team. And then the last one, but certainly not the least one, is focus on mental health and well-being. And so for here, it's all about prioritizing self-care and well-being needs. And people can do that through, for instance, items such as yoga mats or smart gardening. So now that I've gone through these different categories, potentially introducing a few different types of technologies that maybe are new when it comes to healthy aging, I want to again take a moment to pause. Again, feel free to write it down and throw it into the chat if you feel comfortable to answer this question. What comes to mind when you think of healthy aging? Planning. Home care, full life. Access, eating well. Perfect. Thank you so much, everyone, for adding those into the chat. So what does this look like when it comes to our services and solutions? I'll just go over it very quickly. We've got two main programs. Best Buy Healthy Homes is, some of the technologies we talked about today as it relates to those different categories. That's tech solutions for the support health and well-being. And then Best by Digital Citizen, when I spoke about digital literacy, it's our free e-learning platform where people can learn about technology at their own pace. So feel free to access both of those different programs on bestbuy.ca/health. And all of this, ultimately, all of these categories come together to impact somebody's quality of life. And so what I would encourage you to do is to continually move the dial by thinking about new areas and categories that could impact our healthy aging. Thank you very much for having me today.
Thanks very much, Claire. That was fantastic. And so we've got time for a few questions before we reach 10 minutes past the hour. Looking at the board of questions, there's a general set of questions around privacy and security, records retention, and pushback regarding AI. And so I guess I would ask each of the panel for a quick comment on those. And so we'll start with you, Sara, and Farhad, if you'd like.
Sure. That's a very big question. It has a lot of different aspects to it. All I can say is security and privacy are very important concepts, and you need to kind of have them in mind in design, not after things are built. But at the same time, it's very important to make sure that we don't limit what can be done to help others and bring value, because there are security and privacy concerns. So the really good way to go about it is to make sure that it's done in a very transparent way, and you kind of design all that built in. Now, technicality of it, there's a lot that we can actually talk about, whether it's where the data is stored. For example, something that is very important to us is we have a multi-layered storage system that stores some of the data inside the suite. If it doesn't need to leave the suite, it doesn't go to internet. And then some data stays in the building and some data goes to internet when needed. So there's a lot of concepts to talk in that area.
And I'll just jump in as well, just to say that, you know, in terms of trust, it is a very important concept as well for path. So that's definitely one of our research questions that we're hoping to investigate. So whether it be privacy issues or the trust of the path and remote monitoring for older adults and what their perspectives may be on that. Although we do have some standard protocols currently in place for data security, for patient data collection specifically, we are hoping to sort of move forward with better security and privacy protocols, and potentially getting other certifications such as the SOC 2 and HIPAA as well, to really just move forward towards a better secure program as well. Yeah.
That's great. Any thoughts from others?
I can jump in from the research side. I can't speak too much to sort of regulations and standards outside of research, but what I often say to, you know, the care partners or POAs of those who are agreeing to let us, you know, sense their loved ones is that our sensors are often binary. So they send data in ones and zeros, and I give the sensors a unique participant code that is linked to the patient, but it's, you know, it's not like participant LA would be participant Laura Ault. It's a very, you know, it's a 4-digit unique number. I use Google Randomizer. So if there were to be a data breach, you know, it would say, you know, sensor 123 reported 1 as in motion at 1:15, which means very little to anyone unless they know what type of sensor that is and where that sensor is and who that sensor belongs to. So just as on the research side, again, I can't speak to sort of outside of research, but on the research side, we keep participant names and any participant identifiers outside of the sensor and the sensor data. And then of course I keep the log that links the two, but that's all locked and encrypted and everything like that. So strong, concerns around security, but, we do our best. And that's why I do also have to go through a research ethics board anytime I want to do these kinds of projects to make sure that I am actually protecting our patient data.
Thanks, Laura. Claire, anything to add?
I don't think I have anything to add in addition to what the panelists have already said there.
Okay, we've got a question. It was related to smart tech and dementia, but I think it's relevant to everyone to comment on. Or excuse me, smart communities, the first presentation. I got lost here. Quality of life is important. I think we all agree about that. And how does social health come into experience and connectivity? And then maybe for you, Laura, Nadine, from a staff perspective, and from you, Claire, from a consumer perspective. I know you mentioned a bit about that, but so Sara, Farhad, do you want to kick it off?
Yeah, I mean, that's a really great point. I think, sociocultural factors are very important. They're really quite integral to individual health and older adults' health, specifically on this topic. And so our aim is to really understand older adults' perspectives as well. So we are hoping to really work with the stakeholders to understand their needs and cater to their needs. And whether it be socio-emotional, sociocultural influencers, also in terms of things like social participation, that plays quite a huge role towards social health. And that's something that, through remote monitoring, we can also instill within these smart communities. But that's really very integral part of the program as well. I don't know, Farhad, if you have anything further to add on that.
I think you pretty much said it. I would just quickly say that smart communities are about connectivity, but that's not just connectivity of devices and technologies. It's actually just as much about connectivity of people living in the community. That's why every time we're thinking about a way to connect devices and technologies, at the same time we think about a way to connect people and different kind of roles within the community.
I'll maybe just add there, I think that's actually the perfect connection point there too. I think exactly what I was going to say is it's ultimately finding ways and giving people the choice, which also came up in the chat earlier today, on how they want to connect with individuals within their communities. And so for us, really thinking back to some of those categories of staying active, for instance, or supporting mental health and well-being. So thinking about how different things can come into play to ultimately enable somebody to connect with others in the way that they would like to. So that's a big part of what we like to think about. Again, looking at it from that holistic perspective, really thinking about how each of these different elements is a very case-by-case, person-to-person experience.
I'll jump in on sort of our research side. So part of our study that I didn't touch on too much because we only had 10 minutes, but part of our study was to actually follow up with the family members of our patients and say, if you were able to get a daily or a weekly report from Greystone about your loved one, what would you like it to include? And a lot of people were like, I'd love to know how often they got out of bed at night, how many falls they had, etc. But something that came up too was sort of, what do they do during the day and how do they spend their day and who do they visit and do they have friends? And from a sensor side, especially when I'm trying to think of unobtrusive sensors, so sensors that live on the walls or under the bed versus wearables, that's really hard to sense. Because, as soon as somebody leaves their room, I don't have any sort of, Bluetooth blinky to track them along the floor unit and be like, oh, look, room A and room B are hanging out for a couple hours. Like, we don't have that yet. Maybe, I don't know if that'll ever come, but that is something that, family members are very interested in knowing. So it's sort of something that's a little bit on the forefront of our research brains is how can we gather this information? And I'll let Nadine, if she wants to add in anything else too on her side.
One of the aspects that our staff really found beneficial with the alerts was that it wasn't an alarm that went off in the patient's room. So those types of jarring alerts that could cause fear, that could cause confusion, were not present. It was a way to kind of notify our staff that we need to go check in on this patient. And a lot of the times, like on the unit that we had the study running on was one of our secure units. So these are patients that have an allotment risk. And, you know, we want to promote movement, freedom of movement, autonomy, and patient-centered care. And when we would receive these alerts, we'd be able to go in to the room, check in on the patient, just eyes on, not sometimes even going into the room to do anything, but sometimes just that gentle redirection away from you know, a patient kind of trying to get outside of the room at night, or looking for agitation. We were able to redirect from those pieces. So it really helped, I think, overall in that continuity of care.
Thanks very much. That's great. Great responses. So that's time for us, unfortunately. Thanks to AGE-WELL. Thanks very much to the panelists. That was fantastic and great discussion. Thanks for everybody who attended, of which there were many, and many fantastic individuals, names we all recognize. For all the participation, the questions, the summarizing on the board, better than what I could have done. Thank you very much. And I'll leave everybody with the question that we're seeing on the Q&A, which we won't be able to address, which is research and implementation, something that frustrates us all. So we might hear more of that. I'm sure we will in our next session. So don't forget to join tomorrow, the day after, and the day after that. There's more to come. Thanks, everybody.
Thank you very much.
Thank you very much.
Thank you.
Thank you so much.
Bye.